Raghu,
Yeah.
go ahead.
Yeah. Good evening, Srinivas Ganugal.
Yeah, welcome, Srinivas garu.
Yeah, thank you.
Hi, good evening, everyone. Welcome to MATA Health and Wellness Awareness Seminar. Hope all are doing well. Nowadays, we are all busy trying to multitask and juggle ourselves to give a happy life to our family. But turning our lifestyle a bit to lead a healthy and peaceful life is very important. So, MATA team is gathering here with our doctors, Mrs. Amita Padmanabhani, MD, Dr. Sachidanand Kamtam, MD, and Dr. Saraswati Lakkasani, MD, to guide us without any delays. Let's get into the today agenda. I would like to hand it over to Kiran Garu to speak about our MATA.
Namaste, Andy. Good evening, everyone. As we all believe that health is wealth, and health and wellness awareness seminar will be very helpful for our MATA community. Especially, I'm interested in all the agenda topics, including the balance of work-life balance, including the proper sleep, and what will be the health habits for good life. Then mental health awareness and how you can manage stress, followed by preventive screening. Recently, I went through one of my family members get into some of this stuff, and how important is a preventive care is that one which is very, very important to most of our folks, right? So prevention again. So anything we take care of our health before, right? And better than anything is a prevention, right? So that's what we kind of focus on, and especially today we have excellent set of doctors panel. That is Dr. Amita Garu, which is endocrinology, diabetes and metabolism, and Dr. Saraswati Garu is the board certified gastroenterologist, and also we have Dr. Sachidananda Garu is a psychiatrist, and we definitely expect a lot from you, all these doctors panel, and I think our community is also looking forward to hear from you. Without much ado, I would like to hand over to Srinivas Garu. Srinivas Garu, please address our community.
Yeah, thank you, Kiran and Sridhar and Philly team for the great initiative. See, guys, there is a background. Anybody, can you guys mute? Yeah. Yeah, thank you, Dr. Amita Garu and Dr. Saraswati Garu for your time, because, whenever there is a health comes, we all need to be very, very careful with respect to, our life, because see, life is infinite. How best you can make it, fruitful and useful in the journey of the life, that's where the health comes into the picture. Regardless of what work you do, how you do, we all need to be very, very, cognizant about the health. And then today we may learn some tips and some preventive measures what we need to take in order to improve our health. So, like Kiran said, prevention is the better than cure. Instead of reactively, when the disease comes and you go to the doctor and then you take the prescription and you all do that is given. But before go to the doctor, what else we can do to prevent the actual diseases and the mental stress? I see there's a great agenda items put together for the team. Thank you again for your time and effort to participate in the MATA Health Awareness Seminars. I welcome you all, and hopefully this will be a very informative and educative session for all of our MATA members. Without further ado, I request you guys to continue. Thank you.
Yeah, well, yeah. Thanks, Srinivas Garu. I think the event coordinators Raghu Visam, Suresh Reddy, Vinod Manga, and Satish Nalla, I think you have done an excellent job. I
Thank
think
you, guys.
Sridhar Gudala, he's the leader in Philly who is running the entire Philly team. Sridhar, can you please address our community?
Yeah, good evening. మనకి అందరికి తెలుసు ఈ మధ్య క్లోజ్ ఫ్రెండ్స్ లాట్ ఆఫ్ దెమ్ పాస్డ్ అవే. So as soon as we came to know about that, we right away we did 2 awareness programs. One is term insurance and estate planning, and also the financial awareness seminar. Right after that, health is wealth, as everyone is saying. So this is the one we came up with. Mata more into the health, the fitness challenge is happening, and also we did successfully conducted a health camp in New Jersey. Not only here, back home also, we selected a village, and we helped many with their health screenings, dental and also vision, and we end up doing the with the doctor's help, high surgeries as well, and we provided the free medicine. So there is a lot going on. So please make use of the events, the different initiations that's happening, and we enjoy the life, and make sure you were taking care of yourself and your family. Thank you all, and without any further ado, and Dr. Amita Garu, please take it over.
Yeah, hello everyone. My name is Amita Padmanabhani. I'm an endocrinologist. I've been in practice for last 20 years with various clinical roles. And I'm very glad to be part of MATA Health and Awareness Seminar today. As someone said, this actually stemmed, the first time they approached me was when end of last year, when few of our friends who are young with small kids passed away with sudden cardiac death. And there was a lot of anxiety and kind of restlessness among a lot of people when I talked around. So I feel this is a very great platform and great opportunity. So taking that, I definitely want to educate people and know a little bit about what is the sudden cardiac death. That's how I will start my topic, and then we'll roll into more on the lifestyle modification and things that you could do to improve on well-being. Okay. So first thing is sudden cardiac death. We also call that a sudden cardiac arrest. What does it mean? It's suddenly the cardiac activity ceases. Most of us, our first guess is, hey, this is because of a heart attack, which is particularly blockage of the arteries and coronary artery disease. That's what comes to everybody's mind. But I want to also tell you there are many other things that can cause this, just to create awareness. These are very rare, but I want to let you guys know. Heart is a very complicated system. To keep it very simple, more than 90% of the cases where someone sustains a sudden cardiac death or arrest are because of a structural heart disease. What does we mean by that? So some problem with the structure of the heart. So first thing is always we talked coronary artery disease or the blood supply or the blood clot or atherosclerosis, whatever they can call, that's the main reason. But there are other things, like there is a problem with the muscle of the heart. They call cardiomyopathies. Again, there are many kinds. You probably hear young kids exercising and they drop dead in the gym. That's because they have HOCM. That's a different kind of cardiomyopathy. Then there are valve problems, as heart has so many valves. Any valve issue can be a problem, myotic valve, aortic valve. Then somebody born with a coronary artery disease, they are obviously at high risk. Or if they have a issue with the drainage, like the aorta, there could be an aortic dissection. About only 10% of them, especially in young people who are under 45 years of age, don't have a structural heart disease. What does that mean? Our heart is made of very complicated electrical supply. So there is a special way the electrical wiring is done. Any issues with that will push into the sudden cardiac arrest. Just to keep it simple, there are a ton of conditions people call like Brugada, short QT, long QT. Then there is a family history of sudden cardiac death. Obviously, they are about 1.5 to 2% at higher risk in the sequential family. So that's to pay attention. Direct injury to the heart, like the pericardium. We recently saw Damar Hamlin, right? He is a player of Buffalo Hills. He became unresponsive right on the court. He was resuscitated on time. He's good, and he's now cleared to go back to his game. That is called commodio cordis. Sometimes it could not be a related issue with the heart. It could be just there is an acute blood clot in the lung, or there is an acute bleed in the brain, or there might be some drugs. So the hypothesis is, these were not previously diagnosed. right? Screening is a way to pick up anything before it presents itself. So kind of there's probably there, but they go undiagnosed. The hypothesis is when there is an acute stressful event, like somebody did a marathon and they didn't replace well, so they have a low potassium or low magnesium, or somebody had an ischemic event, or they were taking some drugs that can irritate the heart, or it could be just like a psychosocial factors. These things can trigger the heart to go into a rhythm, which is not sustainable to life, and they become unresponsive. Remember, the key for this is early resuscitation. If you find somebody unresponsive, don't waste time. If you know CPR, do that. But first thing you have to do is call 911 or call EMS. You want to rescue that. I mean, unfortunately, I came to know someone yesterday. He's young. He had cardiac arrest while doing his practice for dance sessions. Fortunately, everything happened on time. He was resuscitated by his friends, and the hospital is nearby. Gladly, he's good. He had no neurological damage, and he's improving. So time is the key. Please remember that. Unfortunately, men are a little bit higher risk of having these compared to women. And unfortunately, again, there are no symptoms for this. People who survive, they say, oh, I had a chest pain few weeks before, or they had shortness of breath few weeks before. If you have any of the symptoms, please don't neglect. Early you check it, the quicker you can fix these things. To complete the sudden cardiac death, I'll just quickly talk about the cardiac screening test. The first thing is obviously talk to your primary care and then ask them. They would do a risk stratification, is what they call it, based on the history, based on the family history, based on conditions you have. And there are so many scores like ASCVD scores that they use. They basically assess, oh, you are low risk or are you at a high risk, and then they suggest the appropriate test. Worst case, even though if you're not at high risk, if you request that I want to have an ECG, I'm sure they will do that. Even in India, every package, they have so many labs, they have packages. Every lab has a cardiac package. They do all these tests. They do ECG, they do echocardiogram. So these are worth considering. Screening ECG will pick up any electrical issues. Echocardiogram will pick up any structural issues. Some blood tests like CRP, measuring free fatty acids will help. The tests that are more commonly done these days is a non-invasive CT-based test called, one is calcium artery scoring, the other one is called CT angiogram. These are non-invasive. This is not like someone going through angiogram. This is just done like a basic CT scan, how they do for a CT chest or CT abdomen. What they try to measure is, in one test, the calcium scoring, they try to measure how much of calcium burden that's there in the coronaries, which indirectly is like a measure of how much coronary artery disease you have. So someone is not waiting until they have a heart attack. If they see enough calcium score, they will put the cholesterol pill, they put the Plavix, aspirin, everything ahead, so you're preventing a heart attack. Okay. And then other one is CT angiogram. This is mainly useful for people who are at higher risk, so they can look at the anatomy of the coronaries. So I hope people utilize these and then discuss with your primary care physician. So I will move on now to how to improve lifestyle. So we talked about what are the bad consequences, but what else can we do to not to go to that situation, right? So I just said most cause is coronary artery disease. So whatever the risk factor for somebody to have a coronary artery disease will be the same risk factor, whether it be for sudden cardiac death or arrest or something else, which are high cholesterol, high blood pressure, smoking, physical inactivity, obesity, diabetes, and then the family history of early or premature cardiac disease. If anybody were to take a guess, or if probably a few people know, South Asians, they seem to have 4 times more likely to have type 2 diabetes compared to any other population. Same thing, 2 times more likely to have heart disease than general population. Why is that? The second question is normal BMI. Everybody knows what is normal BMI. Anything that's good is up to 25. We call obese when someone is over 30. But when it comes to Asians and Asians Americans, they reduce the normal BMI to 22 and obesity to 27. Why is this discrepancy? Why a 30 for an American? Why a 27 for a South Asian? So we don't know the reason, but there have been several studies that said South Asians have low muscle mass. Remember the word, low lean muscle mass compared to other ethnic groups. So therefore, that they call that consider increased risk for diabetes or high cholesterol or heart disease. So what is our plan of action? So obesity was actually declared as pandemic in 2021. How we know a COVID pandemic, obesity is now called a pandemic. So we all cannot afford to be obese. So what we have to do is to focus on lifestyle modification. Goal is how to stay healthy. So I'll start. First important thing is with exercise. The question that comes to mind is, okay, so exactly why should we exercise? What are the benefits of exercising? We all know exercise helps XYZ, but I'll tell you, exercise improves your muscle strength. It improves your muscle mass. We just said why we have so many of problems, because we have low muscle mass. So you got to improve that. It improves, obviously, your lung capacity. It improves your heart capacity. We all saw during COVID time, people who are exercising, who are fit, actually did well compared to people who are obese. They have more mortality and more morbidity. Then it improves our bone health, especially for elderly. It prevents osteoporosis. And then it improves our mood. It improves our sleep, our brain health. It improves our self-esteem. You look good. You won't have weight issues. So coming back to now, we learn the benefits. What is the recommendation for exercise? Remember, it's 150 to 300 minutes of moderate intensity aerobic exercise is what is recommended. That is the minimum. If you break it down, it's 30 minutes, 5 days a week. That doesn't sound a lot. So if you spend 30 minutes, 5 days a week of moderate intensity exercise, that will give you a lot more fitness. If you're already an exerciser, push yourself. You can do 75 to 150 minutes of vigorous aerobic activity. And remember, out of the 5 days, try to keep 2 days your muscle strengthening activity. And then the next question, obviously, on the interactive session, people might ask, what do you mean by a moderate physical activity? What is the definition of exercise? We all walk, we all do our physical activity, we cook. Is that considered an exercise? That is considered as physical activity. Exercise means anything where you're increasing your heart rate is called exercise. So when you call it moderate intensity, you should have your heart rate increased by 50 to 70% of your maximum heart rate. Now I'm adding another math. What is my maximum heart rate? So generally, you all can Google, there are so many apps for it, but ballpark, remember, is 20 to 220 minus your age will give your maximum heart rate. So for a moderate intensity, you want to achieve 50 to 70% of your maximum heart rate. If you're not good with technology, you could do a talk test. A talk test means the American Heart Association said, if you're doing moderate exercise, you are breathing harder than you're at rest, yet you still be able to speak. You're not interrupting or grasping for sleep. That is called the talk test. There are several ways we could get our exercise. The first thing is we all underestimate the power of walking. Walking is a very great and a low impact exercise that will help us meet our goals. If you're a beginner, I would say start walking briskly, 10 minutes a day for first 3 weeks, and then slowly increase your time of walk by 5 minutes per week until you get your goal of 30 minutes, 5 days a week. If you're already a walker, you're at an intermediate level or advanced level, I would say increase your pace. Say, for example, you're walking a mile and it takes about 15 minutes. Now you want to try to increase your pace and do the same mile in 12 minutes or 10 minutes according to your capacity. Or use 2 to 3 hand weights while you're walking. That also increases your intensity. Those are some of the tips. Then obviously other forms are swimming. Swimming is a great exercise, especially for people who have arthritis or joint issues. If you are not a swimmer, even walking in a pool walking is a very good intense exercise because you're walking against gravity. Other forms to whoever you like, one you could do cycling or jogging. according to your taste. Again, some small tips: whenever you're parking a car, try to park at the end so you have enough steps before you get to the door. Take elevator instead of taking elevators, try to take stairs. Consider wearing a pedometer, and the goal target is 10,000 steps a day. Obviously start small. You don't want to go to 10,000s on day one, or don't do any aggressive physical activity on day one. Again, it puts more stress on your heart. You always want to build your endurance gradually. Other things that you can do is if you're at work, take a 10 to 15 minute break, and then go for a walk. Especially these days, most of them work from home. So take time and say, okay, I'm going to go stand up for 10 minutes, go for a walk and come back, or before your lunch or after your meals. Make sure you take a time to do the exercise. Consistency is good. How do you keep up with this is do fun challenges, or do competition with your friends, or have somebody accountable so you stay motivated and reach your steps. The second part I want to focus is the diet and nutrition. One of my professors taught me what you put in your mouth is a reflection of your health. It is such important. We have to be cognizant of what we eat. In this day world, there is so much of fast food and so much of attractions everywhere. We have to stay content as much as possible. Generally, if someone is obese, we always say weight loss. But what is weight loss? How much weight loss do you consider as enough weight loss? So studies have shown all you need is 7%. If you lose 7% of your weight, that's good enough to reverse all the metabolic complications like diabetes or high blood pressure or cholesterol. If you look in the grand scheme, 7% is not a lot of weight, which is easily achievable. In terms of diet, another thing I generally say to my patients is, you have to eat how you tell your child. What do you tell your child? Don't eat junk, eat on time, eat fruits, eat vegetables. That's what we should be doing too. Unfortunately, we don't have time, but that is something we have to do. Otherwise, you cannot fight these pandemics. In terms of diet, obviously, I say cut down or stop any diet indiscretion. What does that mean? Avoid fast foods. Limit your fried foods. Try to limit your desserts. Avoid sodas. Cutting down on the portion size. What do I mean by portion size? Say for somebody who's eating 2 or 3 cups of rice, cut it down to 1 cup of rice. In honesty, generally they say you should not exceed more than 45 grams of carbs as a meal, and not more than 15 grams of carb as a snack. But then the next question is, what is 15 grams of carbs? 15 grams of carb is about 8 inch of roti, or this small idli is 15 grams, or 1/3 of cooked rice. I'm talking about cooked rice. 1/3 of cooked rice is considered as 15 grams of carbs. So if you're eating 1 cup of cooked rice, you're done. You're done with your meal. But then how would you sustain? So you have to be creative in how you make your meal. I call that smart eating. How would you do that? So you could add a cup, for 1 cup of rice, you can add 1 cup of vegetables and 1 cup of egg or protein, and you get a 3 cup of fried rice. You just have to be more creative with the information. The other thing is, okay, how about bread? A slice of bread generally is 15 grams, unless you're buying a thin cut bread. On the other hand, if you're eating a bagel, so many times we just drive by, get a bagel, but the right 15 gram of portion size is 1/4 of a regular size bagel. So you cannot eat more than 3/4 of a bagel. So you have to be cognizant of how much you should eat. And if you're overeating, try to get to an average balance between those two. Try to replace with lean protein, meaning avoid red meat as much as you can. Say if you're eating chicken, take out the fat and do the meat. Try to do more plant-based fats with all your meals. Obviously, you want to eat vegetables, fruits, whole grains, unsaturated fats like avocados, nuts, sunflower, olive oil, canola, soybean. Those are all better. Try to steam when possible, rather than deep fries. Try to boil them, try to bake them, and try to avoid eating after 8 p.m. If someone wants to do diet, there are about 19 to 20 different diet programs out there. But the two I suggest for heart health is the Mediterranean diet and the DASH diet. So they will give you long run. Most of the diets you have to be careful when you pick, because they are good in the short run to help you lose weight, but then you'll miss most of the nutrients and they are not good long run. So having a healthy, balanced meal, you will never go wrong. So the third thing I will emphasize is alcohol. Avoiding excess alcohol intake. Heavy alcohol consumption and binge drinking has shown to increase the risk of sudden cardiac death, and they have a name for it. They call holiday heart syndrome. So be in moderation, not more than a drink or two. Then the fourth thing is the sleep. In this Western world, most of them suffer from insomnia, whether it be due to stress, health, stress of work, stress of family, a lot of factors. Insomnia could be very different flavors. Some people can get to sleep, or they have difficulty staying asleep. Once they wake up, the thoughts start to come in their mind and they can't stay asleep, or they don't feel rested when they wake up. The recommended amount of sleep is 7 hours. Why? Because it is the second half of the sleep, is the non-REM sleep, is where our body and mind consolidates. So therefore, you need to hit the second half of the sleep. You need a minimum duration. Some people think they can survive sleeping 4 hours, but then you're not hitting the deep sleep. So when you don't hit the deep sleep, you will have issues with cognitive performance. You'll have memory issues. People complain commonly is brain fog. Their immune system will be an issue. They have quick issues with infections, a lot other metabolic problems. So minimum, remember, is 7 hours, 7 to 9. Some people need more. So it's not abnormal. Some people need more. 7 to 9 is perfectly fine. Exercising early in the day, or at least 1.5 hours before bedtime, has shown to improve both the sleep quality as well as duration. My last disclaimer, if someone has problems with the sleep, like sleep apnea or insomnia, please don't neglect. It has its own consequences. So please get them tested and treated. Then the biggest thing is work-life balance. I'll go to point number 5. First of all, what is work-life balance and why is it so important that we need to have? So work-life balance, all it is basically refers to is maintaining a balance or a harmonious relationship between your work and personal life. In an ideal world, what it means is after work, we should be able to spend time on things that nourish us as people, like spending time with friends, family, or engaging in a hobby. I generally tell my patients, work is not life. Work is part of life. You're not born to work. Work is just a part of life. So how do you balance this? Especially in this given age, there is so many stresses. I do see people who work 2 jobs a day or 3 jobs a day. They're juggling between their family, and then wife used to be a homemaker, but now they equally work. They are balancing work, family, and then house. So there are so many factors, and there's so much of stress. There is so much of corporate stress that influences, and then there is so much of pressure as a hierarchy or to achieve something, different goals to different people. So then the question is, why should we spend the time on the work life? Why can't we just keep going, working and working? So in one study, they saw that people who are working more than 55 hours a week, or someone who's workaholic, they saw a higher risk of strokes. There is a higher anxiety, depression, burnout, fatigue, obviously stress-related health issues, and there's a decline in physical health. We generally think if you're working 8 hours a day, we are producing 8 hours of productivity. You work 10 hours, you're making 10 hours of work. Unfortunately, that's not true. You actually end up, the longer you work, you end up working more, but you become less productive. And this is a loss for you as well as the company. Sometimes you have to bring it up to them. But how do you save yourself? from this healthy work-life balance? How do you create that for yourself? It's not easy. Everybody has a different hurdle, but I will just give you some tips. Hopefully this will help you. The first thing is setting boundaries. That is a tough thing, but you should be able to do that. Setting up a clear boundary and say for yourself between work and personal life, and say, okay, I'm going to work till 4 o'clock or 5 o'clock. That's it. I'm not gonna try to get it work beyond 5. There's a saying that says work expands to fill time allotted. What does that mean? Especially when people are working from home, it is easier to let work spill over into your personal time. You don't even realize, you don't look at the watch. You have the urge, okay, let me work for 1 more hour. Let me finish this meeting in 30 minutes. And then it takes an hours together. But you got to put a boundary to yourself. So first thing is set a time to end the work for the day. And how do you reinforce that? How do you do that? Is power down your work-related devices, lock your office, or schedule something. If there is a meeting, schedule into your next day. You can use apps to block distraction, websites during the day, so you are completely focused on the work. When you're working, you're just working. That gets you more efficient. And then try to keep at least one work-free device, so you can disconnect completely from work. The one thing I say is, if at all possible, try not to have your email on your cell phone, because it's a constant distraction and it's a constant OCD to check your mails or constant alerts. So you have to figure out what works for you. The second important thing is time management. How do you manage your time efficiently? You have to organize and prioritize your tasks. You have to prioritize what is important for you in your personal life, your kids, family. Is it your hobby? That should be as important as your prioritizing your work. Work is only for money. Think about it. Work is mainly for money. But then there are so many things that you're born for. Obviously, I'm not undermining the task of money. It is important for us. But the corporate company, as you all see, the more you work, the task gets harder and harder. You have to speak for yourself. How else can you do a time management? So if you find yourself, say, for example, there are several meetings that you have back to back. You are trying to take them when you're going for a walk, or maybe you're sitting at your son's football play. Take a meeting there, if at all that's possible, instead of sitting in an office and getting locked up. You can use productivity hacks like Pomodoro timer, so you can work in short and you can do a focused burst. Then that leads to the third important thing is stress management. How do you manage the stress? The number one thing is by doing regular physical activity. Again, we are back to square one, which is exercise. Regular physical activity. Exercise helps to regulate the hormones of stress. The stress hormones are your cortisol, the growth hormone, the epinephrine, all these things. Again, they boil down to the anxiety, the mood. So this exercise helps to regulate all these hormones in our brain, and that's how it helps with our stress. So engaging in regular physical activity, again, supersedes, it helps. But what are other strategies that you can do? One is practicing mindfulness. So what is that? Which is meditation or having breath awareness. If people who have Apple Watches or any smartwatches, you see after a certain time, it says, take a deep breath, keep moving. Periodically, it sends you an alert. Why? Because it will create you, or you become more in tune with your emotions and physical sensations. So therefore, apps like this will help you. There are so many mindfulness apps if you want to download. They generally help you handle the stress. Other thing is taking a break. Okay, after 1 hour, you make it a point and say, okay, I'm going to get up. I'm going to take a 10-minute walk and then come back and then refocus myself. You have a better productivity. Same thing, as I said, unplugging from work-related activities when you feel stressed. It is you who know when you feel stressed. When you feel stressed, don't push yourself. Take a break. Pushing yourself will just decrease the productivity, adds more stress. So take a break. The other thing is obviously taking time off, especially in this day and of age where there's a lot of work from home. People are not even completely utilizing their free time. So try to utilize your sick time, your personal time, vacations, bereavement. They are very important ways to nourish your well-being. If possible, try to outsource some of your work. Obviously, as I said, you will have some obligations at your workplace, but you can try to outsource, like, hey, if you need some cleaning, or if you need laundry, if you need some cooking, if at all you have a possibility, try to outsource your work. Then the last thing is flexibility. To have a happy, work-life balance, try to find that flexibility, meaning you should be able to adjust your schedule to accommodate any unforeseen circumstances or personal needs that are going to come upon without jeopardizing your work and life. And then in the last is, if you feel overwhelmed, I say, or you feel stuck, then there are people who you can talk to, like professionals, like you could do a life coach. They can help you with that. And the other thing is, in terms of the stress management, I do tell to a lot of my patients who have a lot of worries to the point that are beyond your control. I say one thing you can do is, okay, take down a paper, break it down into two halves, and then put all your problems. The first thing is fixable, non-fixable. Put all your problems separated out. List all the problems that you have that you can fix. List everything that you have that you cannot fix. And then once you write down the problems you cannot fix, don't even go back and think about it. Just go focus on the things that you can work on. It will just help you feel better, and it will give you a lot of more stress relief. So to end my speech, I would say one word of advice: always start small. You are more likely to stick with a new habit if you start with a small target. And remember, consistency is the key. Thank you. So I'm open to any questions now.
Yeah, I have few questions. Thank you, Amita Garu. So we have created few questions. So from the team, so let me pull those questions. The
Sure.
first question about ECG related. If ECG graph shows normal, so is it still recommended to take stress test?
So that would depend on again the history, the family history. If somebody falls on a high risk, or if they have a family history of heart disease, then they should definitely consider beyond that.
Okay, thank you. And second question, can we get this test without any prescription? If you can list us, medication test to get done annually, what are the reading for each test we have monitored?
Sure. So generally here in US, you need a prescription to get any test. I think Dr. Saraswati Garu will cover the pre-screening. So most of will be covered by that, but general screening they do is a metabolic profile, A1C, cholesterol profile. Those will be your, and the CBC, those will be your routine screening in your yearly physical. And if possible, have them also check your thyroid. Yeah.
Thank you. I think remaining questions we can ask you in the end of the session. So we are going to give the other professional doctor. So would you like to go, Saraswati Garu?
I thought I was going.
Yeah.
Is
Okay. Yeah. You can go there. Thank you. Sorry.
All right. Okay. So my name is Dr. Kam Tam. That's excellent talk. Go ahead. Somebody
No, that's an echo. That's an echo, doctor. You can go.
Okay. All right. So excellent talk, Dr. Padmanabhan Garu. That we covered extensively. Lots of topic. I will stick to children and adolescents. Okay, I'm a child and adolescent psychiatrist. I practice in Exton, Pennsylvania area. I would start by thanking Mata and my friend Sridhar Garu and Raghu Garu. They both are community leaders and they do a lot of service in the area. So I'll try to talk particularly the issues that we have in our community, particularly South Asians, which would be South like Indians and Telugu population. So we were all like immigrants. Okay, we were raised in certain way, and then we are in this alien land which has different demands, and our kids are in a different environment. So that needs a different kind of parenting, which is which is not what we are used to. So this is one of the common struggles I see with lots of patients and the parents who come to me. The same kind of parenting rules and then values that we have back in India might not everything would be pertinent here. Let me start off by saying, corporal punishment, like hitting your child, is absolutely no-no. Even a threat of hitting your child is an absolute no-no. It traumatizes your child. It can cause other problems, and then these are things that they remember for the rest of their lives. So I'll break up some. I'll give general recommendations. I'll break up from ages from the time 0 to 5, from 5 to preteen, and preteen to a young adult. So I'll try to break up this way to give some recommendations. At around age 1, 2, that's when the child is walking around, getting to know, learning few words. As a parent, what you do is, you play with your child. This is up to age 5. This is where some of the habits for rest of your life are set, actually. There are lots of studies which indicate that what are your food habits, your taste, all these are set before age 5. Okay? As Dr. Padmanabh Bhumigaru mentioned about diet and how we in South Asian diet is very low protein diet. Okay, so this is the time where we can correct our dietary practices and make a much healthier diet. So what you feed your child, how your child eats, and what is your child's relationship with the food. This is determined at this age, okay, before age 5. So some of the common negative practices which we see in our community is you feeding the child, you're trying to force feed the child. The child is watching TV while you're feeding him. And in general, being Telugus, we eat a lot of rice. Okay, so but the majority, 90% of the calories in any given meal is rice. So these things can be corrected, as Dr. Padmanabh Bhumigaru said. You need to substitute the grain with vegetables. Sorted vegetables is good. A protein portion, and then some very a smaller carbohydrate portion. Setting some structure at this age, 0 to 5, is very important. Teaching your child what is the appropriate time to watch TV, and there's a limit on your TV. Okay, the recommendation by recommended TV time or screen time is, believe it or not, 20 minutes a day. Okay, now that is not practical. We know, at least limited to half an hour. Okay, of screen time, which is non-educational screen time we're talking about here. Okay, so if you have that kind of a setup in place, you won't have resistance from your child, from your kid. Okay. But if you give it a free hand, then the kid is always thinking about when is the next time I'm going to watch TV. Then you will have that struggle. There's going to be that fight, daily struggle between you and your kid. Okay, there is an expectation set that you have your TV time at this time of the day for this amount of time. Then that's what usually most kids stick to it. From about age 5 onwards to preteen, this is where your kid would be interacting more with the external world. He'll be forming friends. He'll be forming groups. He's going to try to have some understanding of what's your culture, what's your family background. So here again, here also you need to be a friend to your kid, mostly nurturing, give structure. There should be some discipline, but you should not be only a disciplinarian, like what we see, like in Telugu movies or something. A parent doesn't talk properly to his child, is only giving instructions, and then the whole interaction is about yelling or screaming at your kid. Okay, so this is not how it should be. It should be a very nurturing relationship that you should develop. Okay, this is a foundation that you'll have for the rest of the life. And then at about teenage years, pre-teen for girls, and then when you're hitting teenage for boys, there's lots of body image issue here. So again, this problem can be addressed in a much younger age, where when you have appropriate dietary practice, nice lifestyle, where your kid is dividing his whole day into appropriate times where he would exercise, have physical activity, where he's doing his homework and schoolwork. So he will definitely develop into a very good body image. So some things, what I found, just going to like some of the interaction which we have with our kids. Lots of parents, they tend to yell and scream, okay, instead of having a proper talk. Okay, that's something which is very commonly seen among us. Okay, when I say among us, I could also be guilty of doing the same thing, but there's some recommendations which we say. The second thing is I'll give an example, right? One kid comes and says he just had his lunch, and then in 1 hour he comes and says, "I'm hungry." Okay? So typically we grew up when our parents would say, "How can you be hungry? You just had your food, so you cannot be hungry," right? Okay, so this kind, when you say this for a 4-year-old or 3-year-old who might genuinely be hungry, he might not have had like a proper meal, you're not validating his feelings, or like he felt hungry. Okay, so you are creating a doubt in his mind where he felt hungry and he came to you to ask for like something, food or a snack. You are basically dismissing what he felt. So that creates psychological problem there. The way you word, the way you talk to your kid makes a huge difference. So the same interaction, you could make it positive. You could, instead of saying, "How can you be hungry? You just had your food," you could say, "It looks like you're more hungry, even though you just had your lunch. Okay, so what do you like to eat?" Okay, so you can change the whole interaction in a positive way. So in general, as a parent, you should be a nurturer and you should provide a structure. Okay, so that's what parenting is in this day and age, in this environment in US where we live. You talking to your kid, developing a sense of identity is very, very important. Okay, because this is what they, when become teenagers, this is what they really strive for. Okay, and not having a sense of identity creates a lot of confusion. So now the question is, what do you mean by identity, right? Okay. So identity is who you are, where you came from, and having a healthy sense of yourself, right? Being a immigrant from India, okay, you should talk about positive things about it, not necessarily lying about it. Being a Telugu, like the good things about Telugu, being engaged in Telugu communities or Manabadi programs, or being engaged in Telugu festivals or Hindu festivals, going to temples. These all create a sense of identity, and hopefully it is a healthy identity. Okay, there are some unhealthy identity we do create because of the kind of people we are, like Telugu people. There's lots of caste-based identities which might not be as healthy, but in general, if you create an identity which is healthy, that is very, very important. You should try to do that before your teenage years. Now, there was a question about sleep, right? Sleep has to be a structured activity. Okay, so we all It is a very, very, very important thing. Dr. Padma Bhumigaru hinted about it. When you do not sleep enough and adequately or efficiently, you're going to have lots of stress. Your body reacts in a stressful way. It releases hormones, which are stress hormones, which can lead to metabolic syndrome, which can lead to diabetes. It can lead to accumulation of fat. It can lead you to not be able to handle the stress of your day when you do not sleep well. That can lead to mental health issues. Okay? So the general rule is the younger you are, the more sleep anyone needs. Okay, so the 7 or 8 hours is for a grown up. Okay, when we talk about grown up, somebody who's 21 or over, when you're between ages below 5 or 4 or 5, that child needs about close to 10 to 11 hours of sleep. When you're preteen, you need about 9.5 to 10 hours of sleep, and teenagers also need about 9 hours minimum. Okay. Now that is when I give education to anybody who comes to my office. This is what I tell: in a 24 hours cycle, you need to take away 9 hours. That doesn't belong to you. That is your sleep time. Only when you sleep well, you will be efficient. Okay. The problems with obesity or any ENT issues, where if you're snoring at night as kids, okay, that causes a less efficient sleep. Okay? And then when one of the indications of less efficient sleep is you're waking up tired, it takes you a long time to get going. And another one I want to say is about, there's a lot of stigma of mental health in our community. Okay, mental health is very, very important. It is no less than physical health. Okay. There are unfortunate incidents in the local school districts. We hear about kids committing suicide. Okay, if you really look at it, the kids who kill themselves, they tend to be much more than a kid who's dying of a heart attack or of any other physical health issues. So it kind of indicates that mental health is very, very important. Okay, do not neglect it. With all the resources we have in the community, you should seek help, seek therapy, at least initially. School counselors. Okay, there are crisis management teams in every school district. There is a mental health hotline now, just like 911 is for physical health, 988 is for mental health. Do not neglect it. Regarding medications, that's a bigger topic, but at least start by therapy. Okay, most teenagers, they are much more. Are we good? Hello?
Yes, we are good.
Yeah. So most teenagers are more comfortable talking to somebody who's not a parent. So they might hold themselves off, might not be able to express what they're really feeling, because there's lots of things that they go through. There could be their body image issues, there could be bullying in school, the stress of academic performance. There could be social issues where they might have had problems with their friends, relationships, and all that. So do not hesitate to seek help. Okay, at least start by school counselor. Okay, they are trained to address these issues, and if they feel that they need higher level of care, they will reach out to the parent and advise them to seek therapy or something like that. I'm open to questions. If there are any questions, or they can reach out to me later.
I have a couple of
I thought I heard Sridhar Garu, but you're breaking up.
Suresh,
I have-
Suresh Garu, any general questions you can
yeah,
ask?
I have a couple of
Personalized,
questions.
we can route it to the doctors later, but general, yeah, go ahead.
There is a one. I mean, we created one. I think especially about children's anger. So that might interest it because of everyone has a kids and how to handle, and how to handle children's anger and screen time. You already expressed anger, screen time, behavior, negative thinking for kids in the age, especially in the early teenagers like 12 and 13 years.
12, okay. So that's where in the pre-teens, right? So
Yep.
now it all it's so what I would also caution is one advice might not fit everyone, right? Because the circumstances of where the anger is coming from, what the relationship, how healthy is it between you and your child. It depends on how you handle all this. Now, if somebody is angry, now is that the time to discipline them? Probably not. Okay, you should first, if they're having a temper tantrum, they're acting up. It is not the time where you punish them. You say that you lose your phone privileges. You say that you're grounded. That's probably not the time. Let them cool down. Okay, and if they a lot of times it is the frustration that comes out as an anger. Okay, even for a parent who yells, screams, sometimes they might threaten or hit. That is a parent's frustration. It's a parent temper tantrum that happens. So the rule number one, let them cool down. Okay, that is not exactly the time where you want to discipline your child or give them some education about how they should conduct themselves. And that is not when you interact with them. If they are being oppositional, they are being disrespectful, you have to acknowledge that and say that you're being disrespectful. This is not the time I want to talk to you. Why don't you calm down? We will talk to you later. You have half an hour to calm down. You can come back later. We'll talk. Okay. So that's one way of addressing. But then the core problem, what happened, if there's an ongoing issue, then that needs to be addressed. In general, most of the time nowadays is about the phone privileges. Okay. The rule in my home, and I tell all the parents, is the phone does not belong into the bedroom. The phone should be charged outside the bedroom. Any social media activities, parents have to monitor it. Okay, and the phone is a privilege. There should be a contract written for young parents whose kids have not given smartphone yet. This is a good idea to have a contract written saying that the phone belongs to you. You're lending it to your child, and the phone cannot be taken to the bedroom. The phone has a purpose for communication. It has to be charged in the kitchen. Any social media accounts have to be created by the parent, and they have full access to the social media. So once they are older teens, you can give them more freedom, but as a younger kid and a preteen, there should be some restrictions on it.
Okay, thank you, Sachin. So another simple question. So the screen time, right? Especially when the kids playing outside. Okay, there is 5 kids are playing and one kid bring their phone. Yeah, I think he started to playing games and whatever it is on the phone and watching YouTube something. So remaining other kids, I mean, after a couple of minutes, everyone going to now sit with him to watch. So
Right.
how can we prevent this kind of
So that's
situations?
that is tough, right? So what the recommendation I gave was when you're home on a regular day. So in a social gathering, kids are doing that. You can tell them, but it's very hard to prevent it. You don't want your kid to be the only kid who's not with a phone, right? That's another issue too. So any child wants to be part of a group. If he doesn't have a phone, either in my case, I try to prevent my kids having phone to as much as I can. But then I had to give in because they are being excluded from some kids' activities. Other kids were planning to play basketball outside. They couldn't be invited because they don't have access to the phone. So that's a tricky thing. Some things you ignore it, but then if it's really going out of hand, then everybody in that group, the rule should be to be all the kids. Nobody should be on the phone. That's the only way to work.
Yeah, that's excellent actually. So the thumb rule we have to convey to the folks before we social gather. Thank you.
Right.
So we'll ask like a remaining questions in the last, so that we don't have much time. So Saraswati garu, our time to.
Yeah.
Thanks.
It's a nice talk, Dr. Amita and Dr. Kamtam Garu, and I'm going to talk more about the medical and clinical testing for the prevention and screening for all the common endemic diseases. So far, they covered. Yeah. So these are the common metabolic syndromes that are like a silent endemics in the community. Like you never know until you have these diseases until you get tested. By the time maybe you are at the terminal stage of the disease. That's why the US Preventive Services Task Force, they created some guidelines based on the prevalence of the disease in the community. What are the common highly prevalent diseases you should be screened with your every doctor visit. So the common, can you go back to the previous slide? I'm going to tell to go to the previous slide. Yeah, so the heart disease, cholesterol, hypertension, type 2 diabetes, dementia, and several cancers, and PCOD and NASH, that is a non-alcoholic fatty liver disease. These are the very common endemic diseases which need to be screened on regular basis, irrespective of your family history, irrespective of your lifestyle. And next slide. So the government came up with some guidelines. So these guidelines are based on the common patterns in the United States. So everyone need to be aware of these guidelines. Whenever you go to the doctor, these are the things you should be focusing, and you should be aware of all these guidelines, when to go to the doctor and what are the tests you have to done based on your family history, your medical history, your lifestyle. And irrespective of all these, also there are certain tests you have to go through. So all these are above 18 years. Are adult patients I'm going to talk about. Irrespective of the sex, there are some tests every male and female patients has to get done. In every routine checkup, you have to go to your primary doctor annually, irrespective of your employment checking or something related to your occupation. Irrespective of those two, you still have to go to regular checkup every year, and you had to get screened for the depression every year, once in a year, and you had to get screened for the illicit drug abuse every year, and you had to get checked for the pelvic and breast examination for the female patients every year. And if you have any smoking history, everyone above 65 years, they should be screened at least one time in their life for the abdominal aortic aneurysm by doing the abdominal ultrasound. This is only one time screening. And if you have any elevated blood pressure reading on one occasion, especially during your office visit, because during the office visit everyone is anxious, so their blood pressure will be elevated. If that is a scenario, you should be having ambulatory pressure monitoring to confirm the diagnosis of high blood pressure before starting the medication. And every female above 35 to 40 years, the primary doctor will be starting discussing about the mammography. And after the age of 45, every female will be getting the screening mammogram on alternative years. And cholesterol screening or lipid screening, everyone above 20 or older, they should be getting their lipids test done once in every 5 years. And if you have a family history or high risk lifestyle, then you should be screened for this very often than the regular population. And any person above 45 years should be getting screened for the colon cancer. And if you have a family history, you should be getting screened much earlier than the regular population. And this colon screening will be once in every 10 years if you have a normal colon. If you have something abnormal, then your screening will be more often based on what is there in the colon in the previous year. And if you're not interested in getting the colonoscopy for the colon cancer screening, there are few non-invasive tests also available called Cologuard or fecal occult blood. And these are very non-invasive. You can get them done even at home also. If they come back positive, then within 1 year, you should be getting the screening colonoscopy. and certain And coming to the diabetes screening, any high risk individuals, we will be getting tested earlier, less than 40 years old. If it is no risk factors, then you should be getting screened after 40, once in every 3 years. And all the patients above 18 should be get screened for hepatitis C above 18 years, and hepatitis B, everyone will be getting screened irrespective of their risk behavior. And very often, if you have a high risk behavior. Next slide. And because in US, the tuberculosis prevalence is very low compared to India, here they get test for the latent tuberculosis only in the high risk people. And lung cancer screening, if any person has at least 20 years of smoking history, they should be get screened for the lung cancer with the low dose CT scan after the age of 50. And if the patient stopped smoking more than 15 years, then this screening will be avoided. And screening for the osteoporosis, especially the females, anyone age above 65 or older, they should be getting the DEXA scan for the osteoporosis screening, and this will be done once in every 2 years. And cervical cancer screening, if for the females, if patient is like 21 to 65 years, pap smear will be done once in every 3 years. If the pap smear along with the HPV viral screening is done, then this screening will be done once in every 5 years if the HPV is included. And post-test cancer screening, this will be done in patients above 50 without any symptoms, and it should be done in patients 40 years with a positive family history. Mostly this prostate cancer screening, they are done with the combined test, including the prostate specific antigen and the digital rectal examination. And screening for the sexually transmitted diseases, especially if the patient has a high risk behavior, they should be getting HIV screening more often. If not, HIV screening should be done every year until the age of 65. And you can extend this after 65 if there is a risk factors. And these are the screening tests commonly done in the general practice. And apart from that, you guys should be focusing on getting the immunizations as a part of your prevention of the diseases. Everyone should be getting the chickenpox vaccination, especially if the adults, if they don't have a history of chickenpox in their past, it is recommended to get at least 2 doses of the chickenpox vaccination. And COVID-19, irrespective of anyone, they should be getting the COVID vaccination as per the guidelines. And diphtheria, tetanus, and pertussis vaccine, Tdap, this is like a 1 dose of Tdap, and then you have to repeat the booster dose either with the Tdap or TD once in every 10 years. And flu vaccine every year you should be getting, because similar to the COVID-19, the flu virus also have the variants we will be changing. So the vaccine formula also we will be changing every year. So every year you should be getting the flu vaccination. And hepatitis A, it has two doses. Especially this is indicated if you're traveling to a endemic countries, like where the hepatitis B is very prevalent. If you're traveling to those countries, you should be getting hepatitis A vaccine of two doses. And hepatitis B, especially this is given immediately after the birth, 0 to 6 and 8 months of duration. But all the pregnant mothers should be screened for the hepatitis B. And if they are not vaccinated, they should be getting the hepatitis B vaccine. And human papilloma virus, this is up to the age of 26. It has 3 doses. This is for the females, and ages 27 to 45 if they're at high risk behavior. And MMR, it is like a 1 or 2 doses depending on their immune response. Out of all these vaccinations, MMR is a live attenuated vaccine. So if you have on any immunocompromised medication like cancer medication, or if you're having any AIDS, you should be very cautious with these live attenuated vaccines. And meningitis vaccine, People who are at high risk behavior, they should be getting the meningitis vaccine based on your behavior. The next page. Next slide. Yeah, and shingles is like every person above 50 years should be getting 2 doses of the shingles vaccine. This is like a varicella. Irrespective of whether they have a chickenpox in the past or not, they should be getting 2 doses of the shingles vaccine after 50 years of age. And your doctor will be giving you some preventive medication based on your metabolic syndromes. Like if you're having high blood pressure, diabetes, and high cholesterol, you might have been kept on aspirin. You might have been given some chemopreventive drugs, especially if you have a high risk of breast cancers, all those things. And everyone should be counseled for the tobacco cessation if they have a smoking habit, and if they have a family history of genetic diseases, and they should be getting the genetic screening and genetic counseling also. And there are certain preventive medications to prevent the HIV infection if we are living in close with the HIV positive people. That's called PrEP. Like, these are the drugs you can take on daily basis to avoid the risk of getting the HIV if you are living in close proximity with the HIV people. And for the pregnant women, there are special more screening compared to the normal population. So they will be getting screening for the syphilis, HIV, hepatitis, gestational diabetes, and gestational hypertension, depression, and RH typing of the mother, RH typing of the baby after the birth, and screening for the urine culture irrespective of the symptoms, because pregnant patients may not show the symptoms even though they have the UTI. So these are and nutritional counseling. These are the few additional tests all the pregnant people will be getting. And being a hepatologist, we are screening the people for the fatty liver on a daily basis if their BMI is more than 25 to 29.9. So the screening for the fatty liver, we will be doing by doing some liver enzymes. It's a simple blood test which includes the liver enzymes, and we will screen for the HbA1c also, and we'll screen for the cholesterol, because these are all the factors implicated in causing the fatty liver. And apart from that, if the BMI is very high, they should be getting the nutritional education. They should be getting like annual, more often annual preventive screening office visits. And adult with a diagnosis of hypertension, diabetes, cholesterol, and any other metabolic syndromes, they should be getting the nutritional screening. Next slide. Can you go to the next slide? So far we have talked what all the preventive measures, tests are available. So I would like to give a brief discussion on the kind of diet. I think someone is asking about what kind of the diet. So Dr. Amita mentioned about the DASH diet. DASH diet is recommended by the National Institute of Health, especially for the people with high blood pressure and high cholesterol. So these are the things which you have to eat, and this side of the table is which you should avoid to control, to prevent developing the hypertension and diabetes. So I think everyone is able to see what all the things you should include and what you should be avoiding to prevent the high blood pressure and cholesterol. And this one is a fatty liver diet. So few things I would like to focus on here because I treat most of the liver patients. Coffee is very good for the liver. But it's not that friendly for the heart. You may get palpitations. So having 2 to 3 cups of black coffee is protective in patients who are obese, in preventing the fatty liver. And these are all the healthy liver foods, which includes the sunflower seed oils, avocado, and green vegetables, fish and oatmeal, and green tea and whey protein. And be aware, green tea is different from green tea extract. Extract has high dose of the herbals inside, and they are very liver toxic. So make sure what you are drinking. And the foods which aggravate the fatty liver are the alcohol, added sugars, and salt, high salt, and highly processed food, and fried food, and red meat. Can you go to the next slide? So this is a special diet called low FODMAP diet, because many of us will suffer with the bloating, gas issues, burpings and farting. This is very common, especially in the IBS people, right? So to avoid those discomfortable symptoms, this is the diet indicated, that's called low FODMAP diet. Even though some of the diet options are indicated by many doctors, but they may have the possibility of producing more gas. So if you have a more gas issue, you should be avoiding certain healthy foods also, because some food produce more gas with the bacterial interaction inside the body. So if you have that issue, so just be aware which you can eat, which you should avoid. So I have mentioned all those things, even though it looks healthy, like apple, apricot, avocado, blackberries, these are all looks healthy, but if you have a gas issue, these are the some foods you have to avoid. But that's why outweigh what are the worst symptoms you have. Based on that, you have to choose which food you will be eating. And the last one, next slide. So this one I want to be very everyone to be aware, because we will be drinking socially and we think we are drinking very least amount of the alcohol, but you should be aware which kind of the alcohol you are drinking. Like if you see, if it is a beer, 12 ounce of beer, it has like 5% alcohol. So 12 ounce of beer is equal to 8 to 9 ounce of malt liquor, and 5 ounce of table wine, and 1.5 ounce of like a hard liquor. So if you are drinking like, which has hard liquor has 40% of the alcohol inside it. So if you are drinking some 10 ounce of hard liquor in a week, that means you are consuming like a highest amount of the alcohol, and each of these ounces equal to one drink, and that one drink contains 14 grams of alcohol. So if you consume this kind of alcohol, and if your ingestion is more than 60 to 80 grams per day in men's, if it is more than 20 grams per day in females, over a period of 10 years they're going to become cirrhotic. Cirrhosis means like irreversible damage of the liver, so your liver is not going to function anymore. So just be aware what kind of liquor you are drinking and how much amount you have been drinking in 1 week time. So it is indicated it should be less than 2 drinks for the men, less than 2 drinks for the females, and less than 3 drinks for the males per week. So just be aware how much you are drinking per week to avoid the alcoholic liver disease. So with this, I will stop here, because we have some time to discuss on what all the things concerns you have.
Thank you, Saraswati garu. It's a nice information about vaccination and related diseases, and as well as information about food. So I have a couple of questions for you first. So then we will go with random based. So first question is there the singles, right? Is there any singles vaccine available in India for parents?
Yes, but it is very expensive in India. You have to be in the higher corporate setup, then only you will have the availability of that shingles vaccine. Definitely it is there, little expensive.
Okay, thank you. Another question for you. I think I see that apple on the right side, right? Might be if the people have gas, I believe. But I have been grown up with, I think, hearing an apple every day keeps doctor away. Is this something we have to keep in control, eating apple?
I mean, that's what I have mentioned very clearly. So you have to outweigh which is the worst symptom you have, which is what is making you suffer the most. So based on that, you have to outweigh. So I mean, it doesn't mean that you have to completely cut down the apple. You can moderate the consumption of the apple if you have that. That is the main issue you have, only the gas issue.
Thank you. Hope it will be answered from. So I think I have a couple of questions from that all the directors. Okay, pick your question. Then we will give the audience if they have. The first one, Amita Garu, can you provide some color on the symptoms of sleep apnea and how to catch it early? You are in mute, I
You're on
believe.
mute.
Okay. Yeah, I replied on the personal chat indeed to that person. But for a brief overview, sleep apnea, generally you diagnosed with interrupted sleep. Like generally, in it is someone sleeping next to you, they'll tell you like, oh, you are snoring at night, you are frequently tossing. A lot of them have early morning fatigue. They don't feel fresh in the morning. That's a red flag. They don't feel rested all night. That's another symptom. Brain fog is some people say. So those are all the symptoms of sleep apnea. And generally, they can have that tested. Lately, they do home kits. If the home is positive, sometimes they can do in a lab setting and get the appropriate treatment.
Okay, thank you, Mamtagar. I see that your response, but the people, like, most of the majority people suffering with
Sure.
that. So, okay.
Yeah. So
yeah.
generally, I say to add little more to it. One thing, we all are discussing about preventive. I think it should start with the childhood. The childhood obesity is a very big problem lately. Not just in US, everywhere you go to a pediatrician office or everywhere, it's a big thing that we talk about is childhood obesity. And again, that comes with a healthy, disciplined habit. And obviously, when we say obesity, sleep apnea is part and parcel of obesity. It's more like you're in this cycle. So sleep apnea makes the obesity worse. It helps you not lose weight because it builds all your stress hormones. And then you have sleep, and therefore your obesity increases, worsens your sleep apnea. So you have to break the chain by having a weight loss or keeping a healthy weight.
Thank you. Another question, Sachidanand. So, what is appropriate age for the child to have a phone? So this most of the people love to hear.
Phone is a big topic, right? So, I mean, before age 5, I would definitely say no, absolutely no, before age 5. But after age 5, how you use your phone, right? That is what is important. And most of our children, they are pretty good listeners. But then if we create a confusion and do not give them a direction, that is where the problem starts. That's where the unhealthy relationship with phone happens. So even before you give a phone, I recommend certain rules that has to be written. Okay, not to put my kids on the spot here, but they have a laminated rule contract on their desk, which some of the features of which are to tell that the phone is not theirs; it belongs to the parent, and the parent should have full access to the phone whenever they demand. The phone cannot be taken to the bedroom. Social media on the phone has to be uploaded only with the parent permission, and parents should have access to the social media. Okay. And then there is a limitation on the phone, like they cannot be on the phone after they come from school, while they are eating, or when they are with the family. Okay, these are the things, right? Otherwise, you see most kids, they're even in a party and all that, they are on the phone all the time. So it is a necessary evil. It has you can do a lot with it in a good way. Some shy kids, they can, that's their means of socializing. Okay, so it does give them an advantage. But the appropriate limits are very, very, very important. Okay? And the absolute no is taking the phone to the bedroom. Okay, we do not know what's going on the social media. Lots of, I mean, I'm not aware of, I'm not part of any of some of these apps. I mean, Facebook is all for old people, they say now, but what's that, Instagram or TikTok? These algorithms are very much addictive. And particularly teenagers, when the conversation begins between friends at around 10 o'clock, it usually ends at 1 or 2. And lots of talk is about negative things. When somebody says something negative, the other kid is trying to defend themselves, and they rope in other children. So that would be the whole pattern of their discussion at around in the midnight or later. So this one, I'm going to give you one example. If all the listeners might kind of relate to it. Some of them. I'm not saying everyone. Okay? So nowadays, this is a common sleep pattern that we see. Okay? The teenager comes from school at around 3:30 or 4, and they sleep. They sleep for 4 to 5 hours, from 4 o'clock till 9. At 9 o'clock, they wake up at night, okay, and then they have their dinner, and they are awake till 2 or 3 in the morning, and then they're sleeping for another 3 to 4 hours before they go back to school. So, for all the parents who are listening, if this pattern, sleep pattern, sounds familiar to you, then this is a problematic sleep pattern. Your child is awake during the time when you're sleeping. You do not know what's going on there. There can be 100,000 reasons why your child is awake so late, but that is not healthy. Human beings are designed to sleep at night and be awake during the day. So that is a pattern. You know, your hormones, all your hormones are secreted in that pattern. If you're trying to go against it, it's going to cause not only physical health issues, it's going to cause mental health issues. So,
Thank you, Sachidanand. So we're a bit over time. So, I mean, anyone audience, okay, ask any question directly to the doctors. So this is a very good time. It might,
I think someone has been asking about the NASH, right? NASH is like a non-alcoholic fatty liver. It is like a diagnosis of exclusion. So generally, we have to screen if the ultrasound showed fatty infiltration in the liver, and if there is a elevated liver enzymes. So the hepatologist will do all other common diseases of the liver, which gives the elevated enzymes in the liver and abnormal fatty deposition. And if they excluded all other possible causes, and they attribute this is because of the non-alcoholic fatty liver, given patient is not drinking alcohol. And the diagnostic test for the non-alcoholic fatty liver is the liver biopsy, and which shows certain physiological features, and then they confirm the diagnosis as a NASH. And the only treatment option so far is losing at least 10% of the body weight, which will reverse your fatty deposition, given your liver hasn't been fibrosed by that time. And other medications, if patient have coexisting diabetes, there are medications like Ozempic, Trulicity. These are the things they can use simultaneously to treat the diabetes and to control the body weight and help with the fatty liver reversal, all those things. Yeah.
Thank you, Saraswati Garu. So it's time already over of 2 minutes. So thank you note. So can someone, Mata team can give a thank you note to the audience and doctors? Thanks.
I can take that, Suresh. So before we thank you, so I want to have 2 questions. So one is, I'll take it quickly. Any of the guest speakers can speak on that. So people always ask me, like, they have challenges for the sleep time. They go to the bed, they try to sleep first 5-10 minutes, and they bring up their phones. They don't get sleep. Their lack of sleep. So do you guys have any tips for our attendees today who face this? And I hear this all the time.
all right. I think I'll go. Can you hear me? I'll go on that. Okay. It is a behavioral issue. It is as I said, sleep is a pattern. It's a habit. We all have to sleep at certain time. There should be a structured bedtime. We cannot be sleeping whenever we want to. So just like the whole human body has a rhythm, circadian rhythm. So if you're sleeping at around 10 or 11, that's the usual time you fall asleep. But then some of the behavioral patterns that we might incorporate which are native, like exposing yourself to screen or playing video games, having that blue light, these are all can prevent you from sleeping, because there's a hormone in your brain called melatonin, which is secreted at night when it's nighttime. So these kind of things can decrease the secretion of melatonin. And so exposure to early morning sunlight, that helps. Exercise helps. having a strict turn off time. Okay, so there's a somebody coined the phrase turn off and turn in. Okay, so turn off your phone at certain time and then turn in, no matter what. Do not have a habit of going back to the phone after certain time. So this will help. It will not work on day 1. It might not work on day 20 or day 30, but then this is a habit. If you have it, it will it gets ingrained, and then you will have much better sleep.
Thanks for that, Sachidanand Garu. So on behalf of whole MATA team, we thank our guest speakers of the day, Saraswati Garu, Amita Garu, Sachidanand Garu. Personally, it's so many takeaways for me, and I'm sure all the audience today have some takeaways to do for their health and wellness. I really appreciate one more time. On that note, we can wrap the day. And then one more time, thanks a lot for your time this evening.
I think one more last note. So thank you, Sridhar, Satish, Vinod, Suresh, and Raghu. It's an excellent session. And on behalf of MATA again, from the executive committee, I'm going to thank and it's an excellent session. All the doctors, Dr. Amita Garu, Saraswati Garu, and Sachidanand Garu. I think we should repeat this for a couple of other sessions because I see a lot of folks joined today, but we want to also extend this session to the other chapters as well, because I know the timings are a little different. So we'll try to upload this into the YouTube. But again, I would personally recommend if you can have another session like this in the next month or so that it will be very helpful. And one note is we are going to host our first convention of MATA on April 13th and 14th. Please tune up and get ready for that convention. All the doctors on this panel, we are going to invite to that our convention. We will be running some doctor panels and also a couple of other sessions. So Dr. Saraswati Garu is going to coordinate, and she is one of our board of directors. Saraswati Garu, thanks for that, and I hope you will take this forward. And please, Dr. Amita Garu and Sachidanand Garu, please try to attend our convention on April 13th and 14th. You can keep time aside. Thanks, everyone. Phil team, it's a great job. Srinivas Garu, if you are there, Srinivas Garu, are you there? I can see you.
Yeah, go. No. Thank you both for the great session. It's very informative and educative. So we'll continue these kind of sessions in the future on different subtopics. Thank you guys, and thank you, Philly team, for organizing these events.
Thank you, everyone. Thank you, Amita Garu and Saraswati Garu and